Good evening, everyone. Thank you for joining us tonight. Hopefully everybody can hear me all right. If you are having problems hearing me, just let me know. Hopefully everybody got the email that I sent out earlier this afternoon that included the handouts for tonight's presentation. If you did not get that email, just let me know and I'll be sure to send it again. We've got a lot of information to cover tonight, and I'm going to try and get through it as quickly as possible. However, I am more than welcoming of questions. I will pause throughout the presentation to see if anybody has a question. You are welcome to type in questions in the chat box at any time, and I will address them when I pause. Otherwise, when I do pause and ask for questions, you're welcome to simply unmute and ask your question, and I'll be happy to answer it. All right, so it doesn't look like anybody else is going to join us, so we'll go ahead and get started. So again, thank you for joining us tonight. This is Medicare 101, a 4-part, 4-week series to tell you everything you never wanted to know about Medicare. I'm going to start off with who I work for. I am with the Pikes Peak Area Council of Governments, Pikes Peak Area Agency on Aging. The mission of the Area Agency on Aging is to work with partner governments to coordinate and develop systems and services that are designed to help people stay in their homes in the community for as long as possible. The Area Agency on Aging serves a total of 3 counties here in Colorado: El Paso, Park, and Teller. In the Area Agency on Aging, I am with the Senior Insurance Assistance SHIP program. SHIP stands for State Health Insurance Assistance Program, which is a federally funded program that's designed specifically to provide free, unbiased, in-depth one-on-one Medicare counseling and assistance to all interested individuals and their families. So we can answer questions and provide education on all parts of Medicare. We can also talk to people individually about their specific situations, their retirement benefit options. We also assist people who have limited or low income with applying for financial assistance programs specific to Medicare benefits. The SHIP program within the Area Agency on Aging here in Colorado Springs serves a total of 9 counties in Colorado. I've listed those counties on the slide. Every county in every state should have access to a SHIP counselor program. Again, this is a federal program. Every state should have access via toll-free number, if nothing else within that state. I've listed our Colorado toll-free number on the slide. If you call that number from anywhere in Colorado, it will automatically route you to the SHIP office closest to where you're calling from. I've also listed our local Colorado Springs number. Again, this office in Colorado Springs serves a total of 9 counties. Tonight, we are going to talk about original Medicare, eligibility, enrollment, and the different parts, benefits, and costs of Medicare Part A and Part B. In the following weeks, we will also talk about Medicare Advantage plans and Medicare supplements and Medicare drug coverage. But tonight, we are going to focus on original Medicare A and B. And we are going to start by who runs Medicare. So it is actually Social Security, the Social Security Administration, who determines eligibility for Medicare. They are the entity that actually processes applications to enroll in Medicare. They provide Medicare ID cards. And you can contact them by either toll-free customer service number or by going to your local regional Social Security office. Social Security offices are currently open to in-person walk-in visits, although it's still slightly discouraged, and they would prefer that you go to their website, ssa.gov, and create a personalized Social Security account. You can also reach them by nationwide toll-free number, which I've listed on the slide. The access to that number is available from 7 a.m. to 7 p.m. Monday through Friday in all time zones. So it's Social Security that determines who gets Medicare, actually enrolls people in Medicare, and issues you your Medicare card. Once you're enrolled in Medicare, Social Security wants nothing to do with you. And if you have any questions about your benefits or coverage or costs related to Medicare, you would actually have to contact the Centers for Medicare and Medicaid Services, also known as CMS. I will simply refer to them as Medicare in this presentation. So once you're enrolled in Medicare, if you have any questions about your benefits, you would contact Medicare directly. Medicare administers the benefits and the program. They process all the claims and they pay the providers directly. There is no brick and mortar location for Medicare. You can only reach them by a toll-free customer service number, 1-800-Medicare, but that number is available 24 hours a day, 7 days a week, 365 days a year. Or you can go to the Medicare.gov website to try and find the information that you're looking for. Or, of course, you'd also be able to contact your local SHIP office, that's us, if you had any questions specific to your Medicare benefits or coverage. So who can have Medicare? Well, basically in the United States, any US citizen who becomes age 65 or older and has contributed into the system, meaning you've paid taxes based on employment, you contribute into the tax system. Part of your taxes go to Social Security, part of your taxes goes to Medicare. So you are automatically eligible at age 65, or you can become eligible at any age if you're determined to be disabled by Social Security, or if you are diagnosed with kidney failure and stage renal disease and are on dialysis, you can get Medicare at any age. Or if you're diagnosed with Lou Gehrig's disease, also known as ALS, you can get Medicare at any age. And any lawfully admitted resident alien who's resided in this country for at least 5 consecutive years is eligible to purchase Medicare. So when should you get Medicare? Well, many people these days don't necessarily think about retiring at age 65, but there are certain enrollment periods that you do need to be aware of based on turning 65. So based on the fact that you are eligible solely by turning age 65 or older, you will be provided with what they call an initial enrollment period. This is an enrollment period everybody gets surrounding their 65th birthday.
I thought it was 2 months.
No, total of 7 months. And it's the 3 months prior to the month of your 65th birthday, the month of your 65th birthday, and up to 3 months after the month of your 65th birthday. This is called your initial enrollment period. And this enrollment period is based solely on turning 65. If you enroll anytime during the 3 months prior to the month of your birthday, your Medicare would go into effect the month of your birthday. If you enroll the month of or any of the 3 months after the month of your birthday, there would be a 1 to 3 month delay in your effective date. And then we will also talk about the other opportunities you would have to enroll outside of this initial enrollment period. So other enrollment periods that may apply, special enrollment period. Special enrollment period is based on the fact that you delayed enrolling in Medicare because you were still actively employed. To be perfectly honest, that is the only excuse Social Security will accept for not enrolling when you first become eligible, is if you are actively employed and you have employer group health coverage through that active employment. So you can delay enrollment into any part of Medicare while you're still working and have employer health coverage. When you are deciding to stop working or that work ends, you would have an extended window of 8 months to enroll in Medicare once that employment ends. And that's considered your special enrollment period. So it doesn't matter, doesn't have anything to do with your birthday. It's simply based on the fact that you were working and that employment ended. And we'll talk about that in more detail coming up. And then the last enrollment period for Medicare is going to be the general election period. So if you did not enroll in Medicare during your initial enrollment period, or you did not have a special enrollment period opportunity because you were working, you just decided not to enroll in Medicare, you didn't realize you had to enroll in Medicare when you turned 65, then you can still enroll in Medicare any year down the road during the general election period. General election period is every year from January 1st to March 31st. If you are enrolling during that time frame, specifically because you didn't enroll during your initial enrollment period and you didn't have a special enrollment period to fall back on, your coverage typically would not start until July 1st of that year you enroll. If you are enrolling during a general election period because of those situations, it is likely that you will incur a late enrollment penalty, and we will talk about those penalties coming up. This is what the Medicare card looks like these days. I usually refer to it as the red, white, and blue card. Simply has a person's name, their 11-digit Medicare ID number, which is simply a random series of letters and numbers. And it will indicate when your hospital Part A of Medicare and your medical Part B of Medicare go into effect. That's all it will ever indicate. It will never indicate whether or not you have a Part D or a Medicare Advantage or anything like that. It will just show your A and B effective dates. Something to make note of in order to be prepared to enroll in Medicare, make sure your mailing address is up to date at Social Security. It is more often than not that people who never got their Medicare card that should have gotten their Medicare card didn't get it because they didn't have their address updated at the Social Security office. And so that card was automatically sent to the wrong address. The last thing anybody wants is to have their Medicare card fall into the hands of someone who is not them, and it potentially be used to get services under your name. So it's very important to make sure that information is up to date. You can do that by going to the Social Security office and filling out a form. You can go to the Social Security website, ssa.gov, and again, open your own Social Security account, or you can call 1-800 Social Security number and update that information over the phone. And just be aware and keep in mind that neither Social Security or Medicare will ever call you to see if you've received your card. So if you receive a phone call or an email or anything like that asking if you've received your card or to verify that you've received your card, it is probably a scam because they simply do not do that. In the email that I sent out earlier today, I did include several handouts. I included a couple of handouts from Social Security. This one in the slide is simply showing you the different kinds of things that you can do at the Social Security website. And then the other handout was how to enroll in Medicare on the website. I also included a handout on how to create a My Medicare account on the Medicare.gov website. Neither of these accounts on either of these websites are required for you to have. They are strongly encouraged that you create them, and there are benefits to having done so, but they are absolutely not required to have, and they're not required in order for you to be able to enroll in Medicare online through Social Security or any other services or activities. But again, there are benefits to having those accounts. If you create a My Social Security account on the Social Security website, it does allow you to get income benefit estimates. It can confirm that you have enough quarters to be eligible for Medicare. It can also provide you with the ability to print a temporary Medicare ID card if you lose your card or never got one. You have the ability to see any notices being sent to you by Social Security in real time. By creating a My Medicare account, you have some of the same benefits. You can look at claims in real time. You can keep your drug lists and pharmacy preferences on that account. So again, there are always going to be benefits to having those accounts. They're always very secure accounts because these are government agencies. Creating a My Social Security account is a little more time consuming because it is a much, much more secure account based on the nature of Social Security. And you do have to make sure that you log in at least once every 6 months to keep that account open and keep your passwords current. But again, there can be a lot of benefit to having done that. Any questions about any of that so far? Again, if you have a question, you can simply unmute and ask, or you can type your question into the chat box at any time. All right, I don't see any questions or any questions, so we will move on. So now we're going to talk about actual benefits and costs of Medicare, and we're going to start with Medicare Part A. Medicare Part A is primarily going to be for inpatient services. Things to consider when you're eligible to enroll in Part A. First thing you need to know is if you are already collecting a Social Security income of any kind for any reason, when you become eligible for Medicare, Social Security will automatically want to enroll you in Medicare and send you a Medicare card. If you are not collecting a Social Security income when you become eligible for Medicare, it will become your responsibility to contact Social Security if you want to enroll in Medicare at that time. So they will not send you any notice that says, oh, it's coming up on your 65th birthday. Be sure to let us know if you want to enroll in Medicare. They don't do that. If you're already collecting income, they're going to assume you want Medicare, so they will try and automatically enroll you in Medicare. But if you're not collecting income, you need to contact them directly if you want to enroll in Medicare. Again, you can do that online through an account. Again, and importantly, if you are still actively working when you become eligible for Medicare and you have health coverage through that active employment, and this is to include your spouse who may be covered under your health coverage through active employment, you can delay enrollment into Medicare, into any part of Medicare, without penalty in the future. And you can delay that enrollment until you stop working. And again, you have that extended 8-month window of opportunity to enroll once that coverage ends through active employment. Or you can enroll in Medicare anytime while you are actively working to be effective at your convenience. Again, if you delay enrollment into Medicare because of active employment, you will not be penalized for late enrollment later. In order to be eligible for Medicare Part A, and for most of us, Medicare Part A will have no cost. It is a benefit that we earn and we are entitled to get at no monthly premium, as long as you have accumulated enough working quarters into the Social Security tax system. What that means is 40 working quarters over the course of your entire work history have to be earned in order to be eligible for Part A at no cost. 40 work quarters are the equivalent of approximately 10 years of work history, basically private sector work history, paying taxes, employment taxes into the system. As long as you have those 40 work quarters or 10 years of work history, again, over any time during your lifetime, you will be eligible and entitled to Part A at no cost. If for some reason you don't have enough quarters or you have less than 40 quarters paid into the system when you become eligible for Medicare at 65, you can purchase Medicare Part A, but it's not cheap. The premium just for Part A can be as high as almost $500 for this year, and that premium does increase every year. However, if you have a spouse and you've been married to that spouse for at least 10 years, or even an ex-spouse, as long as you're not remarried, you may be able to still get Medicare Part A at no cost through that spouse's work history. Unfortunately, only Social Security can tell you about your eligibility and your options. So if you're not sure if you have enough quarters paid into the system, only Social Security would be able to give you that information. Again, you would be able to get that information by creating a My Social Security account. So once you have Medicare Part A, what does it cover and how much does it cost you? So again, Medicare Part A is primarily going to cover inpatient services. And that includes, for most of us, inpatient hospitalizations for any reason. So Medicare Part A will pay all the costs for you to be an inpatient in a hospital for any medically necessary reason for up to 60 consecutive days at a time. And Medicare Part A will cover all costs for that inpatient hospital stay, regardless of what services you receive while you're there. They'll pay all costs except for a deductible. That deductible is applied per admission to the hospital. And for 2022, that deductible is $1,556 per admission. So if you are admitted to a hospital multiple times in a year, that deductible would be applied each and every time. It's not an annual deductible, it's a per admission deductible. But again, that would cover you up to 60 consecutive days in the hospital, which hopefully would be a very rare occurrence for most of us. However, if you were unfortunate enough to be in the hospital for longer than 60 consecutive days, Medicare will continue to pay for that inpatient hospitalization, but they will start charging a daily co-insurance. What that means is they will continue to pay all costs for your continued stay, except for in 2022, $389 per day for day 61 through day 90. If you're really, really unfortunate and you're still there after 90 consecutive days, that daily co-insurance that they will not cover goes up to $778. And then you start going into what they call your lifetime reserve days. Fortunately, a hospital stay longer than 3 or 4 days these days is a pretty rare occurrence. So hopefully none of us ever have to worry about those 60 plus consecutive days stay, but you do still have coverage even beyond that. Medicare does define a benefit period for hospitalization as 90 days. So those first 90 days. And there would have to be at least 60 days from the time you're discharged from the hospital to the time you're readmitted to a hospital before a new benefit period would apply, and they would be able to charge a new inpatient deductible. If there are less than 60 days from discharge to readmission, you are still in the same benefit period typically, and they will not charge a new deductible. But if there are 60 days or more between stays, you would have to worry about paying that deductible again. Medicare also covers inpatient psychiatric hospital stays, but they do put a limit to how many days total they will pay in your lifetime. There is no limit for medical stays, but for psychiatric hospital stays, Medicare will max out at 190 days inpatient care. There are some items and services that would not be covered while you're inpatient in that hospital. And basically, they're going to be not medically necessary services and items, such as personal convenience items, private rooms, unless a private room is deemed medically necessary and ordered by your doctor. For some reason, no part of Medicare ever pays for the first 3 pints of blood someone might need replaced, but Medicare Part B will start covering it pint number 4. Does not cover private duty nurses or room sitters, and it does not cover what they consider self-administered drugs while you're in the hospital. Basically, self-administered drugs would fall under medications you receive while you're in the hospital on the day of discharge, because on the day of discharge, you're no longer considered inpatient. But if it's taking them forever to get you out of there, to get your discharge processed, and during that time, it becomes time for you to get your maintenance medications. And they come in and they give you that little cup of pills for your maintenance medications. If you swallow those pills, those are considered self-administered drugs because you're not inpatient at that time, and they could potentially bill you privately for that. The other thing to be aware of is, say you go to the hospital under an emergency scenario and you are in the emergency room and they send you upstairs and put you in a room. What you need to be aware of is just because you are put in a hospital room, even if you're in that room for overnight or even multiple nights, that does not necessarily mean you've been admitted to a hospital. You could be what they call under observation. If you are under observation and that's technically not admitted to the hospital, then Medicare Part A does not pay for that observation stay. That falls under a different part of Medicare. And it also affects other benefits that might be recommended after you're sent home from the hospital. So just keep that in mind. If for some reason you're sent upstairs overnight or multiple nights, hospitals are required to notify you whether or not you've been admitted after 24 hours. And they're required to provide you with a piece of paper to sign acknowledging that they've told you that. Another benefit of Medicare Part A is skilled nursing facility. So a skilled nursing facility or inpatient rehab facility would be a benefit that you would have access to after a hospital stay. It does require that you have at least 3 days inpatient hospitalization prior to being admitted or discharged into a skilled facility in order for Medicare to pay for that skilled facility stay. So if you were in the hospital for surgery or whatever, and then the doctor wants to discharge you to a skilled facility for rehab or recovery, you have to be in that hospital inpatient for at least 3 days or longer before they can discharge you to a skilled facility. If you meet that 3-day or longer threshold, Medicare will pay for you to be in that skilled facility for rehab or recovery at 100% for the first 20 days. If you are in that skilled facility for rehab or recovery longer than 20 days, Medicare will continue to pay for that stay, that continued stay, up to another 80 days, but they will apply a daily coinsurance. Again, that means Medicare will pay everything for that continued stay, except for, in 2022, $194.50 per day, starting at day 21. So Medicare will pay all or part of any rehab stay, any skilled facility stay for rehab or recovery up to 100 days. If for some reason you're still in that facility for rehab or recovery longer than 100 days, starting at day 101, Medicare no longer cares why you're there. So Medicare will pay all or part of up to 100 days at a time in that scenario. That 100 days is considered a benefit period, and Medicare will provide and cover an unlimited number of these benefit periods for the rest of your lifetime. Again, you would have to have at least 60 days from the time you're discharged from that facility to the time you might be readmitted to a facility before a new 100-day benefit period would start. But if you have that 60-day distance, when you go back into the facility, you start over. So you get the first 20 days again covered at 100%. And then the next 80 days covered everything except for that daily coinsurance. If you have less than 60 days between discharge and readmission, when you are readmitted, you are likely to go back and start where you left off in that 100-day count. So you continue that initial benefit period. Again, if you're there longer than 100 days, Medicare stops caring why you're there because all payments by Medicare will cease. Medicare covers all or part of up to 100 days at a time because this is for rehab or recovery. And they have determined that if you have not gotten well enough to go home, even if you go home with continued rehab at home, if you have not gotten well enough to go home after 100 days, then the likelihood of you being able to go home becomes very slim. And at that point, your continued stay at that facility is considered custodial or long-term care. And Medicare does not cover long-term care or custodial services in that scenario. The last benefits covered by Medicare Part A are going to be home health care and hospice benefits. Both of these benefits do require that a doctor certify your eligibility with Medicare. Basically, there has to be medical necessity for you to need these benefits or criteria that you have to meet to be eligible for these benefits. And the doctors have to recertify your eligibility every 60 to 90 days. However, if a doctor is able to do that, any services that you receive at home under the home health care or hospice benefits are paid for at 100% by Medicare, and there are no limits to how long you can receive these benefits as long as the doctor continues to certify eligibility. Again, 100% coverage, deductibles do not apply. However, for the home health care benefit, keep in mind that Medicare only covers home health care for medically necessary services. So it will pay to have a nurse come in to check your bandages. It will pay to have a physical therapist come in and continue your rehab. It will not pay for things like light housekeeping. It will not pay for things like personal care, help in and out of the shower, unless it's deemed medically necessary as part of your therapy. It will not pay to have someone go to the grocery store for you, only medically necessary services. The hospice benefit, again, has to be certified by a doctor. And basically, as long as the doctor can tell Medicare that you continue to be in a medical state where you have the potential that you could pass away in 6 months or less, Medicare will pay for any services that may be designed to help make you comfortable at an end-of-life situation. So it will pay for nursing care, it will pay for personal care, it will pay for medications designed to make you comfortable, it will pay for counseling, medical equipment, anything that will help keep you comfortable in an end-of-life situation. Does not mean you have to die in 6 months. Again, there is no limit to how long you can use these benefits as long as you continue to be eligible for them. So potentially, I've had clients who have been on hospice care for years. So again, those benefits are covered at 100%. However, hospice benefits only cover 100% as long as you are receiving those services at home. Medicare under hospice coverage does not pay for room and board if you are in a facility. So it only pays for those benefits if you are in your home at 100%. It will pay those benefits if you are in a facility, but you would have to worry about paying the room and board costs for that facility. So that is Medicare Part A in a nutshell. Any questions about any of that? Again, you can simply unmute or type your question into the chat. All right, I'm not hearing any questions, so we will move on.
I have a question.
Yes.
You said 80% of DME. I didn't catch what that stood for.
I'm sorry, DME means durable medical equipment. So that's going to be oxygen, a wheelchair, walker, those kinds of things, medical equipment to help you while you're at home. Nebulizers, some diabetic supplies, that kind of stuff. And so even if you're getting 100% coverage of the home healthcare services at home, if those services for home healthcare are providing you with equipment like oxygen or a wheelchair, that falls under a different part of Medicare, Medicare Part B. And so Part B only covers those items at 80%. Any other questions? All right. So that was Part A. Now we will talk about Part B. Again, things to take into consideration. And again, if you are collecting a Social Security income for any reason, when you become eligible for Medicare, Social Security will try and automatically enroll you in Medicare. Everybody has to pay a premium for Medicare Part B. And so if you're collecting a Social Security income when you become eligible, not only will Social Security try and enroll you in Part B, but they will also automatically start deducting the monthly premium from your Social Security check that month of eligibility. Again, if you are actively employed with employer group health coverage, and that covers you and or your spouse, you could delay enrollment into any part of Medicare in favor of that active employment with health coverage. And when you are no longer working and covered under that coverage, you would have up to 8 months, that special enrollment opportunity to enroll in Medicare without penalty. But again, Part B is the part of Medicare everybody does have to pay a monthly premium for. Some scenarios where you would have to have Medicare Part B would be if you wanted to get any kind of other coverage to go with Medicare, such as a Medigap or Medicare Advantage plan. Or if you are retired military and you have access to TRICARE for life. If you're not actively employed with employer group coverage, when you become eligible for Medicare, if you want to keep or continue using TRICARE benefits, you have to enroll in Medicare in order to maintain TRICARE coverage. If you're a veteran and not retired Medicare or retired military, but a veteran of the military, and I get this question a lot from veterans, enrolling in any part of Medicare, quite frankly, is optional. There's nothing on the books that says anybody has to enroll in any Medicare benefit ever. So it is always optional. For veterans who use the VA system as their primary health care, which typically does not cost them anything, I get a lot of questions as to whether or not they should enroll in Medicare and what benefit that would bring to them. Because again, you do have to pay the Part B premium for Medicare. And a lot of them wonder whether or not that's going to be worth it if they use VA for everything. Using the VA as your healthcare system is fine and wonderful. And if that's what you choose to do, you're able and welcome to do that. However, it's not active employment with employer group health coverage. So if you chose to not enroll in Medicare initially, but down the road you decided it might be a good idea to enroll in Medicare, you would be penalized for not enrolling sooner, even though you had the VA system in place in the meantime. So keep that in mind. The advantages of enrolling in Medicare if you use the VA system is that Medicare is good anywhere. It's good everywhere. It's good for any medically necessary reason, no matter what, where VA benefits may sometimes be based on specific medical conditions. VA services and facilities may not always be conveniently within travel distance. Again, Medicare is good anywhere and everywhere for any reason. VA may have a few more limits. So there could be a lot of good benefit to having Medicare and being able to get services within the community for any reason at any time. And that would, again, be a choice you would have to make if you're in that situation. Mentioned it already, and I continue to mention it multiple times because it's important to remember. Still working, actively employed with employer group health coverage, you can delay enrollment into Medicare Part B. A lot of people who do decide to continue working past initial eligibility will go ahead and enroll in Part A because it has no monthly cost to them. And there's no real disadvantage to enrolling in Part A if you're still actively working with employer coverage. That hospital benefit under Part A would become secondary to that employer coverage. But enrolling in Part B could be a different decision because you have to pay for Part B, so you would be potentially paying 2 premiums for 2 insurances that may not be necessary. So again, you can delay enrollment into any part of Medicare. You can delay enrollment into just Part B of Medicare. And when that active employment ends, you have that 8 months special enrollment period to enroll in Medicare without penalty, or you can also enroll in Medicare anytime prior to employment ending. So if you know when you're going to be retiring and you have that date already set, you can contact Social Security and tell them you want your Medicare to start the first day of the following month so that you have no gap in your coverage. So it's seamlessly from one coverage to the next. But again, you have up to another 8 months to do that as well. And I mentioned the general enrollment period before as well. If you didn't enroll at first eligibility and you weren't actively employed with group coverage, you can always enroll at any time, any year down the road during the general enrollment period. January 1 through March 31 each year. Coverage typically starts July 1st of that year, and you will have to pay a Part B premium penalty, meaning you'll pay more for your Part B premiums. I do know that January 1st through March 31st and the delayed start of July 1 is going to be changing potentially next year to where if you enroll during that general enrollment period, instead of having that July 1st start date, your coverage would actually start the first day of the next month if you enroll during that time frame. So that will be a positive change. That's what I've heard is going to happen, but until it actually does happen, I can't promise it. So what does Medicare Part B cost? Well, price went up quite a bit this year. So the base premium, the minimum premium for most people for Medicare Part B this year, $170.10 a month. Again, if you're collecting a Social Security income, that amount will be automatically deducted from your Social Security income every month. If you're not collecting an income, so say you enroll in Medicare, but you decide to delay collecting your Social Security income because you're going to wait for full retirement age before you collect, You can still enroll in Medicare, but you will be billed directly for that Part B premium. So they'll either bill you through the snail mail quarterly, or you can arrange to have that amount withdrawn electronically every month from your bank account. If you are going to have to pay a late enrollment penalty, the way that penalty works is that Social Security is going to calculate 10% increase to your monthly Part B premium for every full 12-month period that you were without Medicare and were not actively employed in place of. So for every 12-month period that you did not enroll in Medicare and you weren't actively employed, they're going to tack on 10%. And that 10% is accumulating over time. So if you wait 3 years, it's going to be 30%. If you wait 5 years, it's going to be 50%. And they're going to take that 30 or 50% and they're going to multiply it by whatever the premium is the year that you enroll. Medicare Part B premiums do increase every year. So whatever that premium is the year you enroll, they'll multiply it by the years you were not enrolled. Whatever that comes out to will be tacked on top of the premium of the year you enroll. Once you incur a penalty from Medicare premiums, that penalty is every month forever. Penalties never go away. They last forever and ever and ever. So even a 10% penalty can add up to quite a bit over the course of the rest of your lifetime. So just keep that in mind. The other thing to be aware of is Medicare Part B premiums have become means tested. What that means is the more income you have, potentially the higher Part B premium you will have to pay based solely on higher income. And I'll talk about that more at the next slide. Once you have Medicare Part B benefits and you're paying for those benefits, Medicare Part B basically will have an annual deductible. The annual deductible is a mere drop in the bucket. For 2022, that annual deductible is $223. Once that annual deductible is met, Medicare pays for most Part B services at an 80-20 split. Basic math. Medicare Part B is basically going to cover all outpatient services. And we'll talk about that in more detail in a minute. So again, premiums are means tested. The more income you have, potentially the higher premium you will have to pay. Although there is a threshold, so your income for this means tested premium would have to be at least $91,000 per year for an individual or $182,000 per year for a married couple. If your income is at that or below, you will pay the $170.10. If your income is above that, then you will go to the next tier of premium. As the slide shows, $238 per month per person. The way they determine who has to pay more is decided by Social Security. And the way they're going to decide that is by looking at the most complete tax filing that they can access for any individual. What does that mean? That means they're going to be looking at old information. So hopefully most of us just got our taxes done for 2021. Does not mean our tax year is complete at this point. So for this purpose, hopefully our taxes are complete for the year 2020. That's the information they're going to be looking at. They're going to look at that income to determine if you have to pay a higher Part B premium for this year. So keep that in mind. If your income has changed significantly for a particular reason, when you may get a notice that says you have to pay a higher premium. So say 2 years ago, you were making a higher income. As of 2022, that income is no longer at that level because you retired or for whatever reason. If you get a notice saying you have to pay a higher Part B premium for that reason, you can appeal that as long as you have one of the situations that they will deem allowable to look at that scenario again to determine if you actually have to pay that higher premium or not. They do review that information every year. So just because you may be determined to have to pay that for this year, if your income has changed, that does not mean you'll have to pay it for the next year. So they look at that every year. So what does Part B cover? Well, again, Medicare Part B is going to cover all your outpatient services. So Part A covers inpatient, Part B covers all other services outpatient. That includes doctor's visits of any and all kinds, includes all your x-ray and lab work, includes medical, surgical, and anesthesia services, and Medicare does cover medical second opinions. Again, no part of Medicare covers the first 3 pints of blood someone might need, but Part B will start covering blood at pint number 4, covers all your emergency ambulance transports, covers your annual vaccines, flu shots, pneumonia shots, the shingle shot, covers all your outpatient physical, occupational, and speech therapies, the durable medical equipment, your oxygen, wheelchairs, walkers, that kind of stuff. And there is some limited coverage for other services as long as there's medical necessity, for example, podiatry, optometry, chiropractic services, all those things covered under Part B. Again, after the initial $223 deductible, covered at an 80-20 split. Things not covered under Part B, they're pretty much going to be anything not considered medically necessary. Medicare does not cover routine annual physicals. So if you are used to getting an annual physical where the doctor puts you up on the treadmill, sticks the sticky things to you to take an EKG, Medicare does not pay for those things. Medicare does cover preventive services, which I will talk about more in a minute, but not routine physicals. Does not cover routine foot care, routine eye care or the glasses associated with that. Does not cover hearing aids or the fitting of them. Does not cover dental in any way, shape, or form. And does not cover anything that would be considered cosmetic or not medically necessary. Now, having said all that, there are always exceptions to the rule with Medicare. So Medicare will not cover routine foot care, but if you have a medically necessary reason not to be able to do your own foot care, such as you're diabetic or have pulmonary vascular disease, that would be medically enough reason for a professional to need to do your foot care. If you are developing cataracts, glaucoma, poke yourself in the eye with a pencil, those would be medically necessary reasons to see an eye doctor. Medicare pays for that. Hearing aids, not many exceptions. Dental care, not any exceptions. And then, of course, it has to be a medically necessary service in order for Medicare to pay for anything. And that is the key to Medicare coverage. If it's determined by your doctor to be a medically necessary service, it should be covered by Medicare, period. No questions asked. If the doctor does not tell Medicare it was medically necessary, then the likelihood of Medicare paying for even a medically necessary service, if the doctor doesn't say it's medically necessary, Medicare is not likely to pay for it. Again, Medicare does not pay for routine physicals, but Medicare did jump on the preventive service bandwagon pretty hard when that became a popular benefit for insurance companies to offer. So Medicare does cover a huge number of preventive services. To start with, again, no routine physical coverage, but Medicare does cover what they call a welcome to Medicare preventive visit. What this is an initial visit with your doctor. It's an in-depth discussion with your doctor to establish basically a baseline. And that doctor is going to talk to you about your physical history, your social history, your mental history, your family history, to establish a baseline and potentially suggest or encourage you to get some other types of preventive services or tests. This is a use it or lose it benefit, that welcome to Medicare preventive visit. You have up to 12 months to take advantage of that visit, or you lose that opportunity. Regardless of whether you use or lose the preventive visit, you would still have access to an annual wellness review with your doctor. Again, this is going to be just an in-depth discussion to talk about your health and history over the past year, and for that doctor to potentially make some referrals or suggestions for you to get other preventive services. Again, Medicare covers a huge number of different preventive type services. The best way to find a list of those services would be to get a Medicare and You handbook, which you can do a couple of ways. You can either go to the Medicare.gov website and download the Medicare and You handbook as a PDF. Or you can call 1-800-Medicare and request that they mail you a hard copy of a Medicare and You handbook. A hard copy of a Medicare and You handbook has an additional benefit of being state specific, and would also list all the Part D plans and all of the Advantage plans available in that state. Regardless of how you look at this list of preventive services, and again, it's a huge list. It's about a 20-page section within that Medicare and You handbook. And it will just describe all of those services in detail, tells you what the service includes, what the eligibility criteria to get that service is, and how often you can get that service. And it will always be indicated with a little blue apple symbol to prove that it's a preventive benefit. Any benefit Medicare covers as a preventive benefit, Medicare pays for it at 100%. So keep that in mind. All right, that's pretty much Part B in a nutshell. Any other questions about Part B? I did see your question in the chat box. I'm glad I was able to cover everything. No other questions about Part B? All right. So that is Part A and Part B, what it costs, what it covers, how it pays. Again, I mentioned that there could be some financial assistance programs available for people who have limited or low income, and local SHIP programs do help with those applications. For Medicare A and B benefits, there is a program called Medicare Savings. This is a federally funded program that is designed to help cover the costs of Medicare Part B premium. So at minimum, if you qualify and apply and are approved for this Medicare Savings Program, it will pay the Part B premium for you so that that amount is not deducted from your Social Security check. If your income is limited or low enough, you may also qualify for that program to not only pay your Part B premium, but it would also pay your Medicare A and B deductibles, as well as any co-insurances left over after Medicare pays first for A and B services. If you are qualified, apply and approved for these programs, it also provides automatic help on the costs of drug coverage through Medicare. This, again, is a federally funded program because it's to help cover the costs of a federally funded benefit of Medicare. But you have to apply for it at a local level. And that basically means you'd have to complete a Medicaid application at your local Department of Human Services. But technically, this is not a Medicaid program. For 2022, the income and asset limits are listed on the slide. The income limits are gross income, pre-deduction income. So it would be the income you would get before they take out the Part B premium. It would be income from any and all sources. Social Security does count as income in this scenario. And asset limits. Asset limits listed on the slide are total liquidatable assets. They're primarily going to look at financial accounts, stocks, bonds, property that you own but don't live on, those kinds of things. They are not going to look at your primary home or the land it sits on, your primary vehicles, or your personal possessions, only liquidatable assets. If you fall within these guidelines, again, our office does help. The SHIP program in general does help with these applications, and there could be a lot of savings if you apply and are approved for these benefits. And we're happy to talk to anybody in more detail if you have questions about this program. And that is about it. I think I made record time tonight. Again, if you have any questions about any part of Medicare or any options available to go with Medicare, that's what a SHIP program is designed, and that's what we are here to do. So again, we are available to talk to people one-on-one. We do take in-person appointments at this time. We can also do online appointments over Zoom. We're always happy to talk to you over the phone, or you're welcome to talk to us by email. I'm always happy to answer emails. Statewide toll-free number will route you to the SHIP office closest to where you're calling from. There are a total of 13 SHIP programs in the state of Colorado. Each one of us covers a different region of Colorado. If you wanted more information about the SHIP program in general, you could go to the shipta.org website, and that is the national website to tell you more about the program. After the webinar, sometime tomorrow, you will be sent an email, and that email will include a copy of the link to this recorded presentation. So if you wanted to view it again, you could certainly do so. It will also include a survey. That survey may be an internal survey, but it also may be the national survey done by Medicare and the Administration for Community Living, which is the entity that manages the SHIP program nationwide. We always appreciate people completing and returning surveys to us. It certainly helps us understand better how we are performing our jobs. It also gives you the opportunity to provide feedback and suggestions on other potential educational presentations that you might be interested in us providing. And we're always open to that suggestion. We do not charge for our services. And so these surveys also have a lot to do with how much funding each program is allowed to get every year. Our office is also the Senior Medicare Patrol Office, which is another function of the SHIP program. This is a fraud prevention program that is designed to educate and empower people to protect, detect, and report potential Medicare and/or Medicaid fraud, abuse, and errors. We do educational presentations, but we are also always happy to talk to people who are concerned that there might be a potential billing issue or fraud issue. Maybe you're getting a statement for a service you never received. Marketing issues with insurance agents that there may be concerns about. Any of those kinds of things we're happy to talk to you about and happy to help you with. There is also a nationwide website for that program. I've listed it on the slide, or you can always call the statewide toll-free hotline for those fraud concerns, that 800 number on the slide as well. And again, we are government funded. We do not charge for our services. So of course, we are always happy to talk to you about volunteer opportunities. The SMP program, the Senior Medicare Patrol program, can be one of the more enjoyable programs to volunteer for. It basically involves a lot of community outreach, 10-minute presentations to people in the community about various topics and concerns. We also can talk to you about volunteering for Medicare counseling. So anybody who has any interest in those things, you're welcome to email me and I'm happy to talk to you about those. And that is all I have for you tonight. Any last minute questions? All right, you guys were awful quiet tonight, but I do appreciate the questions. Hopefully this was an educational and useful presentation. I do hope to see you all here next week for part 2 of our 4-part series. Next week, we will talk specifically about Medicare supplements or Medigaps and Medicare Advantage plans, which I'm sure you're all inundated with junk mail about. So again, if you have any questions in the meantime, you're welcome to give us a call. Again, here's our local number, our state toll-free number. I've also put my email address up there. If you have any questions, you're welcome to email me as well. If you did not get the email I sent earlier this afternoon, please let me know. You can do that via email. We have a total right now of 3 full-time, fully trained counselors, a counselor in training, and 2 volunteers. So we are able to talk to somebody or have an appointment with you pretty much at your convenience. And again, we are doing in-person appointments. We can also do Zoom or happy to work with you over the telephone. And that is all I have for you. So I appreciate you coming and joining us tonight. Hope this was helpful, and I hope to see you next week. And with that, with no other questions, I will let you guys enjoy the rest of your night.